The Center for Wellness and Rehab, we are now located, and we've been located here for a while, in the Kelly Clinic, which is behind the hospital, as Steve said. We have physical therapists, occupational therapists, speech therapists, physical therapist assistants. We have an occupational therapy assistant. So we have several disciplines that provide therapy to the people here in Henry County and the surrounding counties. And oftentimes people think, okay, therapy clinic, you're basic, you've broken your arm, you've had a hip replacement, knee replacement, and you come just for your general therapy. Well, we wanted to shine some light on some of the other things that we do at the clinic. And many other places do this too. However, a lot of people don't know exactly what that may mean. So that's what we were hoping to do today. And maybe you'll be surprised at some things we can offer you or someone in your family. So we're going to start off with just different specialties, and we're going to go through them, and different therapists that are going to introduce themselves. No, we're going to introduce them as they come up, and they're going to describe some different things that they do, and I promise they all do them very well. We have some really great, smart people up here behind us. So the first one we're going to talk about is one that I actually do, and some other therapists too. They also work with children, but this is a pediatric certified specialization. And what this means is that the therapist has been out of school for a little bit and then has taken a rather long 8-hour exam that is given nationwide if you want to become a specialist in pediatrics. And then I guess you could say what it signifies mostly is that you're a therapist that knows more about pediatrics than your typical therapist that comes out of school with their master's doctorate degree. So it kind of gives you that little bit of an edge that you do know, have a little more knowledge of every type of pediatric patient that you would come in contact with, whether in just a hospital, in a NICU somewhere, in a spinal cord injured area, those kind of patients that you would see. And recently we have started being able to see patients here in our hospital, as we now have on staff a physician that is able to see infants now. So, or premature infants, and so we're really excited about that. And there again, these kind of skills come into play when we have access to this neonatologist. There are other people up here that also do CPs, and you can do that as well. But we do have that specialty here, and that is something great for us in our community. 40 that. Also, when children are born early, about 40% of children out of 1,000 births, no, not 1,000 births, 1 out of 323 children have cerebral palsy. And every hour, a child is born with cerebral palsy. And that's the kind of children that we see primarily. And a lot of times with those children comes along a lot of other physical cognitive impairments. And so those are the kids we see primarily at the clinic, at Kelly Clinic. Some of the problems they do have are sensory problems, where they can't come in contact with something or someone and act as they should. And that a lot of times is due to the sensory system that we all have. So before I turn the slide over, I wanted to ask you, how many senses do you think you have? How many senses do we have? Go ahead. 5?
8, isn't it?
8? It's very,
6 or 8.
well, it's 7.
Oh, wow.
However, if you read the literature, some of the literature says even 20. Because they'll count like the heat in your body when you feel like you're too hot or you get flushed like with a fever. So they even count those. But a lot of places, a lot of the literature will say like 7. Some say 8. So you have your typical 5. But then there's the sense of balance, which is like the number 6. And someone's going to talk about that in just a moment. Nicole's got that figured out for you. And then number 7 is called proprioception. And that's something that a lot of us deal with. Athletes deal with this, but our kiddos deal with this, and all the other senses if they're born early or have had some kind of injury. And as pediatric physical therapists, we do work with those senses and the sensory system to help get that back. And that's a very difficult thing for a lot of kids that do have some kind of sensory issue due to motor issues and neurological impacts, because they don't feel the same way that you and I do. And so what we do a lot of with our kids, a lot of sensory play, and we also are very proud that in our hospital last year we were designated a center of excellence for joint replacements of hip, knee, and shoulder. So this was a huge deal. We had to work really a long time to meet the requirements, and of having every piece of equipment we needed, of having every discipline and personnel knowing exactly what to do, when to do, what they need to do. And basically what it means is we are practicing medicine following evidence-based best practice with the patients that receive the total joints, and we're doing exactly the same thing that every hospital across the country is doing that has this designation. This is given to us by Joint Commission only if we pass their test. They came in and did the site visit. We had a lot of paperwork to fill out. We had to do several other things as well to achieve this. So this is really an exciting and a great thing for our community and for our hospital that we have this. So it means we're doing the best that we can, the best that there is to do. So this is really exciting for us. So we have that, and that's here in the hospital, of course, because you'll have your surgery here, and then they get to come to us, and you'll hear about what else they get to do along with the other orthopedic patients that we have from the other girls. So, and guys.
Hi guys, my name is Nicole Lambert. I'm a physical therapist. I've been a physical therapist for 17 years, and I've been treating patients with vestibular dysfunction for about 9 years. Vestibular Rehab Therapy is a special treatment area of physical therapy where we work with patients who have dizziness, vertigo, and other balance disorders. It is not a group treatment. I've had a lot of questions about that. If it's a lot of people together, it's a very individualized treatment program because everybody's dizziness is a little bit different. So you'll come in and be evaluated, and we'll give you specific exercises and activities and movement things to do to get rid or help you decrease your dizziness. It can also be used in conjunction with other treatments in physical therapy. So if you're coming for a knee replacement and you also have dizziness, we can add that part to your treatment plan. The different types of vestibular rehab therapy or different diagnoses we treat are the benign paroxysmal positioning vertigo. I know you've probably heard about the crystals in your ear getting out of place, and we can do movement procedures to help get those back into place. We work with patients who have vestibular hypofunction, and that is, so if you've had a virus or a bacterial infection in your inner ear that has decreased the function of it, or if you've taken some strong antibiotics that actually can do damage to your inner ear, we can work with you with that. Patients who have post-concussive syndrome, so if you've had a concussion and you have symptoms of dizziness as a result of that, we can work with you on that. Patients who have Meniere's disease, is there anybody in here with Meniere's? It's not as common, but we do work with patients who have symptoms after their episodes of Meniere's. We also work with patients who've had strokes and mini strokes. Patients who have neurological disorders like multiple sclerosis, and also sometimes cervical spine issues. If you have problems with your neck, that can also cause dizziness, and we help treat those as well.
So I'm going to talk to you guys about aquatic therapy. A lot of people don't even know we have a pool, but we are one of the only 2 clinics in our area that offers one-on-one aquatic rehab for all different types of issues, like if you come in and you're going to have prehab before a joint replacement, or if you just have really bad arthritis and doing exercise on land is really difficult because of the impact on the joints. Aquatic therapy is great for that. We have some really cool little adaptive things or little assistive things in the pool. I'm going to need a volunteer. Carrie, come over here for me. Come on, Carrie. Come on, let's get involved. Okay, so, you know, if we get kids in the pool, yeah, this is, you know, we have kids in the pool and, you know, they're kind of nervous about getting in. We have this cool little fin. Hold still, Carrie. Hold still. Well, they're gonna see it because you're gonna. Here you go. Take this. Take that. There we go. There we go. Oh yeah. Looking good, Carrie. Great. Great. All right. So we have this, and they float. Walk around so everybody can see you. Okay. Yeah. We have flippers that will provide some resistance. Would y'all like to see Carrie wear the flippers? Come on. We have weights that are like little resistive fins that you can put on your hands that create some resistance and different little ankle weights. Oh yeah, we're gonna, Caleb, pump some iron with this. So you're in the pool and you need some resistance, and this is how Caleb keeps his physique right there. So like I spoke about, advantages of aquatic therapy is the decreased compressive forces on the joints. So another good indication for it is a lot of people come in and they're using an assistive device because their balance is bad. They're really afraid of falling. You can get them in a pool, gait train them in the pool. Helps decrease their fear of falling because, I mean, who's afraid of falling over in a pool? Especially if you have the fin on. I mean, you're not terrified of that. Our aquatic therapy program, again, like we like for people to know this, is always one-on-one, just like everything else we do down at the Wellness Center is one-on-one. You're always treated by a licensed practitioner, whether it be a PT or a PTA, and that's it. That's all for me. Y'all give Carrie a round of applause too. That was pretty good.
Hi guys, I'm Sky Prince and I've worked with the hospital for 7 years, and the first thing we're just kind of going to, in that 7 years I finally finished my certification last December as an integrative manual therapist, and really that just means I've had a lot of extra education in hands-on therapy. So, you know, misconception about therapy is that you're just going to come and do a lot of exercises, but we, and pretty much everybody back here, is going to do some kind of hands-on approach and assessment. So this certification, it was really just more education in multiple approaches. So you may go to some clinics that have different therapists that are certified in different things. This just kind of pulls it all together and allows me to assess and diagnose and treat your body as a whole. So one example, if you come in with hip pain, we're going to look for what's driving your pain. So I may end up looking down at your feet. It could be coming from a big toe that doesn't move correctly, therefore you rotate your leg out and now you have knee pain, hip pain, and back pain, and it all came from your toe. So if we don't treat the toe, you're still going to have the same pain, so you have to find the driver. And using hands-on approaches, these are very, very skilled tools. They can find where you have muscle tension. They find areas where people were like, I didn't even know I had pain there, when we get to messing with it. So, and manual approach is very specific to each individual. So if everybody came in, you're not going to get the same techniques. You may see Carrie using an instrument on people. You may see someone using a roller or just our hands. So everything is different and everybody's going to have a different body part that's treated. And not every approach is appropriate for each patient. If you bruise really easy, maybe you don't need more aggressive therapy. So it's when you come in, you get evaluated by me or one of our physical therapists. We kind of determine which manual you're appropriate for. Another area that I also work in is pelvic floor rehab. And one thing people think that this is just for women. That's not true. I treat men and women that have problems in the pelvic floor. And the best way to think of your pelvic floor, it's not just those hidden muscles down yonder. They hold everything up. So when I'm standing here right now, my pelvic floor is supporting me, and it's not letting things leak out while I'm standing here. They're important. And it's not a normal aging process. Most people think when I get old, everything's just supposed to fall out. No, it's not. So it's like any other muscle that you have in your body. If you do not use it, it goes away. So, and it's bowel and bladder. So it's not always just that I tinkle. It can go both ways. And I mean, I also treat patients that, being sexually intimate is still important. So it involves all aspects of that. People may come and see me that have pain. And it doesn't have to be just there. It can be anywhere in the pelvic girdle. So if you are unsure what it is and you would like, just go tell your doctor, I'd like to go see a pelvic floor therapist. I see people for incontinence, and that can be difficulty going to the bathroom. Some people think, oh, well, I go too much. That's one end of it, or I don't go enough. So like I cannot start going to the bathroom. That's just as big of a problem, and that can cause abdominal pain. So just as important. And it's similar to treating, you come in with a bicep that's really tonic with trigger points. These are just muscles. They're just in a private area. So we treat them just the same. So we may do education on how to retrain your bladder or how to break a bad habit. I teach some people just how to find their pelvic floor. A lot of people, I think they've ignored it their whole life until it causes them problems. I do manual in the pelvic floor, so that hands-on treatment comes right back into play. And yes, we do strengthening. There's so much more than just doing a Kegel. So yes, I will teach you how to do a Kegel, but then I'll add to that. There's so many more things you can do, and that can include, I get a lot of people with low back pain or hip pain, and it involves the pelvis. So you kind of get more than just pelvic floor.
Hello, I'm Carrie. I'm a physical therapist, and I have been at the hospital for 8 years, and I have been a therapist for a little over 12. Sky just talked about the manual techniques. Sometimes we need to save our hands, so we use tools to help with that, to get a little deeper and that kind of thing. So the instrument-assisted soft tissue mobilization, a manual technique with specialized tools to aid and treat fascial restrictions, scar adhesions, to eventually hopefully improve your mobility. And these are some of the tools we use. We have a plastic one, and this one is made of jade. And then we also use like rollers. If some of you have been to see us, we probably use some of these things on you. And then with these, sometimes we'll call them a scraper, so we kind of scrape your skin. We'll use a special cream to decrease that shearing so it doesn't just rip your hide off, because that wouldn't be very good. So we use those. And as Sky talks about earlier too, like depending on how you respond to that, we may need to be more aggressive or less aggressive. We don't want you bruising and that kind of thing, so we'll watch out for those. The other thing that I'm going to talk about is taping. And we do a lot of this down at the clinic. So Kinesiology Taping, you may have heard it called Kinesiology Taping, K taping, KT taping, just different terminologies that all basically means the same thing. So it is used to facilitate the body's natural healing process while providing support and stability to muscles and joints without restricting range of motion. So this is not just for athletes. A lot of times people think, oh, taping ankles, taping wrists, like for football practice, football players. It's not just for that. We use it on all ages, all generations. It can be very beneficial. The other thing that we do, or that it's for, like we use it for pain. We can use it for posture and joint alignment. Also for swelling, and there's a picture on there where we use like the kind of weaving spider technique to aid in bruising and swelling. And then the other one there is more for like the stability type, or just for pain. It can also be used on a scar to help improving that mobility and flexibility after surgery and those post-surgical incisions, just improving that flexibility. And then sometimes for nerve entrapment. Let's see. We want to improve the normal mechanics through the biofeedback. So, you know, the tape is on there. It's like somebody's got their hands on you always, so it just helps with prolonging benefits of what we do in the clinic. We can't walk around with our hands on you all the time, so we put the tape on there to aid in that once you leave the clinic. It's latex free, some of the tape that we use, and you can wear it up to 5 days. Take a shower, take a bath, all of that's fine. Usually lasts like 2 to 3 days, but depending on how good it sticks on your skin, it might last a little longer. So the K-tape that we use, I'm going to show you. So it's a little stretchy, and you can see how it stretches, and you can kind of see through. So we can like stretch it pretty good. We don't typically do that much stretch on you because then it can increase that shearing and cause some issues on your skin, and we don't want to do that. But sometimes we give you just a little extra stretch, and that stretch can help lift the skin. So that way it can improve like mobility underneath the skin, improving drainage and blood flow under those layers of the skin. So that's my talk on the KT tape. But then we also sometimes use some other tape that's not as stretchy. See, this is like really tight. And that we're going to use this tape for more of your stability issues. If we're trying to really improve some joint alignment, we will do that.
My name is Caleb. I've been a PTA at the hospital for about 4 years now. I'm going to be talking about rehabilitation. If you haven't heard of that before, that's okay. It's a relatively new term. It was given to the practice of basically playing video games as a form of physical therapy. The Nintendo Wii gaming system was released in 2006, and then it was very quickly adopted by the healthcare profession. The console here, as you can see, it consists of, that's a balance board, and then that is a remote. Each of those have sensors in them that track acceleration, movement, and weight. The balance board has 4 pressure points on it, and it is used to calibrate your center of balance, so that every game you play is custom to each patient. This allows you to translate all of your movements into the game and into the character that you will see on the screen as you play. Rehab has been used to treat patients with Parkinson's disease, stroke victims, general balance and coordination problems, as well as gross and fine motor deficits. This system helps to improve strength, standing balance, coordination, and endurance through active gaming. There have been several studies done on the effectiveness of the Rehab. The most recent one that I could find was in 2017. This was by the Journal of Bodywork and Movement Therapies. The study involved 27 patients who had Parkinson's disease, and they were labeled as a high fall risk. What they did was they took each patient and they had a baseline measurement of their balance using the Berg balance scale and the Tonetti scale, which are both tools that we use at Kelly Clinic. Each patient performed 10 to 15 treatments of Rehab over the course of a month. And then after a month, they were tested again, and each each score increased by an average of 5%. So that is a significant increase. So this is, in the picture you can see here, this was a previous patient that we had who benefited from Rehab. In this picture, I think he's playing the game called Bubble Run. So basically, your character in the game is in a bubble, and you're running down a river, and you have to shift your weight back and forth and front to back to stay balanced and make sure you don't run into any objects and pop your bubble. That was his favorite game, and it was, so basically, Rehab, it's a great tool that helps you to improve balance and strength, but also have fun with it too.
Alright, I'm Jessica. I've been at the hospital for almost 5 years. I'm an athletic trainer as well as a PTA, so I deal a lot with the sports around the county. Currently, I'm covering Inman sports right now. What I wanted to talk to you about was sports rehab. This is an aspect of healthcare that's specifically concerned with prevention of the injury and the rehabilitation process after an injury does occur. It's to get a patient back to optimal levels of functional, occupational, and sports-specific fitness, regardless of your age and ability. This is anybody, you don't have to play professional sports or high school sports to be considered to get sports rehab. Any kind of physical activity, so if you want to get back to playing golf, if you want to get back to running marathons, if you want to get back to climbing to the top of Klingman's Dome. We had a patient recently, that was her goal. Those are the kinds of things that fall into sports rehab. Some common injuries that we treat in this setting, concussions are a big one. Rotator cuff tears or any kind of tendonitis. Labral tears in both shoulders and hips. Biceps tendon injuries. If you've heard of tennis elbow or golfer's elbow, those are some common ones. Carpal tunnel, hip flexors. One of the most common is ACL. I'm sure you've heard of at least one person that's had ACL surgery. We also deal with the PCL, the MCL, and the LCL, which are all located in the knee. Also deal with meniscus tears. Some require surgery, some do not. Ankle sprains, turf toe, plantar fasciitis, and then various forms of tendonitis, general overall muscle strains, and any kind of fractures that are associated with a sport-specific activity. Some of the common treatments that we use, obviously we do a lot of exercise. We are physical therapists, so we like to be active. Stretching, so a lot of what keeps joints and different parts of your body tense is because your muscles are tight, so we add in the stretching, which increases your mobility. We go into the manual techniques, so some of the things the other girls have talked about as far as the taping and the myofascial release work that we do with our hands, and sometimes we'll use the instruments to help with those as well as joint mobilizations. And then we end usually with a modality, so something like IFC, which is the electrodes that we place on a joint or a body part. We have a system called Vaso Compression. It is an ice machine that allows you to receive the cold therapy as well as a compression at the same time. And then we also do cold packs or a moist heat pack. And then sometimes we'll do ultrasound or a phonophoresis, which is an anti-inflammatory in a cream form that penetrates the skin directly to the affected area. Our main goal with sports rehab is to return the patient to their prior level of function, or to play, or even to get back to work doing what they were doing prior to their injury.
Hello, my name is Ashley and I am the occupational therapist, and I've worked here at the hospital for 10 years. Occupational therapy is a little different than physical therapy. There's a lot of similarities. We do some of the manual techniques that some of the PTs and PTAs have already discussed, and we also do taping as well. In the Wellness Center, we tend to be more upper extremity injuries, so we see a lot more shoulders, elbows, wrists, and hands. One of the other things that we do is splinting. That's one of the things that makes us a little bit different. And splinting is fabricating individualized upper extremity splints for upper extremity injuries, weakness, or dysfunctions. And splints can be made to protect joints or to assist in movements depending on the impairment. There's two different kinds of splints that we tend to make. The first one is static splints, and I brought one here. This is a static splint is one that has no moving parts, so its goal is to immobilize. These are used to treat repetitive type injuries like tendinitis. They might be used to immobilize fractures or tendons that are still healing, and they're also used to properly align joints and prevent deformity. So, for example, if somebody has a stroke and they might have a lot of spasticity in their hand, which is tightening and stiffness, and their hand's not able to open, they can't actively open it. Sometimes we'll make them what we call a resting hand splint that kind of opens their hand, and they'll wear that at night, and that's just to keep those muscles elongated, to keep their length so that they're not permanently contracted and then unable to ever open their hand again. And this is the wrist cock-up splint here, and again, this could be used for carpal tunnel, wrist fracture, anything like that. The other types of splints that we make are dynamic splints, and that's where you have one part that is static and the other part is dynamic. So most of the time, these type of splints are used more to increase function. This particular splint is a radial nerve splint. With a radial nerve injury, a lot of times the patient loses wrist extension, and finger extension is the inability to do this. So I don't know if y'all could imagine trying to do something without being able to do this. It's almost impossible. So putting them in this splint increases the wrist extension and allows finger extension so that they can use their hand functionally. And sometimes we use those to assist in just weaker muscles until the muscle has restored to its maximum level of strength.
But I'm Jessica. I have been here at Henry County for 9 months, but I've been practicing as an occupational therapy assistant for 2 years. And I'm going to talk to you guys about adaptive equipment. Not only do we do what Ashley talked about, but we also recommend adaptive equipment that is appropriate for your needs. That way you can function in everyday life with increased independence. So, first, this is a Reacher, and I brought one. And we also have a shoehorn and a sock aid, and those are most of the times called our hip kits. And so those are for not breaking your hip precautions and for somebody who has limited flexibility and mobility. Pretty much just an easier way to put on your socks and your shoes. And that's the shoehorn right there. This is an adaptive utensil, and I brought one. This is an edged plate. I'm using this. We put to the grip, or you can actually order some that are weighted. And this is to help with hand pain, tremors, somebody that doesn't have the range of motion where they can't bend their hand all the way. Let's see here. This is a bottom buddy, and this is for patients who have limited reach and mobility, where you can't fully reach back behind and wipe. We also like to recommend bedside commodes. Those are to use at your bedside. You can use them over the toilet, or you can use them in the shower. And transfer benches, which is to help prevent falls, somebody who has decreased balance, fatigues really easily. It's just a safer way for you to bathe without getting out of breath or falling. So.
Sometimes people need a chair, a power chair, for their primary means of mobility. And at our clinic, we do the power chair mobility evaluations. Medicare requires that in order to get either a scooter or a power chair, that a physical therapist has to do an evaluation at the same time the ATP is there. And that's somebody that comes from the places that sells you the chair. Things have really gotten a little bit tighter with Medicare and the way that they will allow people to get the power mobility. Some of you have had that, have run into that issue. Medicare will pay for one of those only once every 5 years. But you do have to have a face-to-face with your doctor, a face-to-face with a PT and an ATP. But we do offer that service. So you can come to us and we can help get you started on that process, because that is kind of a long process, so.
I'm Jamie Smothers. I am a speech-language pathologist. I've been at the hospital for almost 3 years, and I've been a therapist for 13 years, I think. So a speech-language pathologist, or an SLP, is someone who evaluates and treats children and or adults for disorders. Some of the disorders that we see mainly here at the hospital or at the Kelly Clinic are children. We see a lot of children with autism. Those children have difficulties being able to express themselves and getting their points across. We have a lot of children that just have like a speech delay, so they have specific sounds that they can't say. A lot of people think that speech and language are one and the same. They're actually not. Speech is the actual production of sounds that we say, and language is the rules we use in order to convey our message. So you may have trouble with speech, you may have trouble with language, or both. Somebody could have problems with both. In the hospital, my colleague's going to talk about that here in a moment. We see a lot of patients who have had strokes, so they may have difficulty with receptive. They don't understand sometimes. They can't express their wants and needs. Swallowing can be affected, so she's going to talk to you about that. Okay. So basically that's, and like I said, we see other different types of disorders, traumatic brain injury, we see some dementia, things like that. But I believe the earliest age of a child that we've had so far is 9 months old, and then they're at the clinic, and then we see adults all the way up. So.
Hello. My name's Suzanne Jackson. I'm a SLP just like Jamie. I have been at the hospital for 20 years, and I have done swallow studies for 20 years. I feel like I can do them in my sleep. Anyway, okay, so a swallow study is performed under the guidance of a qualified speech-language pathologist. It's performed in the X-ray department. What I'm going to have you do is I'm going to give you trials of liquid and food. And unfortunately, I have to mix them with barium, which is not a fun thing to mix them with because it doesn't taste good. But it will tell me a lot. You can see this picture right here. So the premise of a swallow study is as you swallow, I can actually watch where the food and liquid is traveling, where it goes, where it doesn't go, and it will record that in real time. So then after you leave, I can go ahead and watch it again, see how your muscles are moving and so forth. So the purpose of a swallow study is to assess the likelihood and or presence of aspiration. Now, aspiration is the term for food and or liquid entering your lungs. That's where we don't want it to go. So not only am I assessing if it happens, but the likelihood that it will happen if it doesn't. And then the results will determine the course of treatment. Treatment options include behavioral strategies. It may just be a simple answer like you are not chewing your food properly, and that is as simple as some of it gets sometimes. I believe I've been VitalStim trained since 2007, so I've been doing that for 12 years. It's hands down the best thing I've ever done in my clinical career. It's called Neuromuscular Electrical Stimulation. It's a non-invasive, relatively pain-free treatment for swallowing disorders. I'm not going to sit here and tell you that it isn't completely pain-free. It's the first 5 minutes are the worst of the treatment. After that, most of my patients don't even know it's there. So I place electrodes on the neck, and then I turn the stimulator on, okay? And then basically you're gonna swallow different consistencies like we did in the, with the swallow study. And I'm gonna be coaching you to swallow hard, swallow fast, or do some other strategies that I ask you to do. Therapy sessions last from anywhere from 30 to 60 minutes. I've even just put them on for 15 minutes before, if I feel the need. The number of sessions is based on severity. My average number of sessions is 3, I'll be honest, 1 to 3. It doesn't take long. It is a highly effective therapy for improving and restoring swallow function. Just real quick, the pilot study that was conducted, they did vital stim on over 4,500 different times with no occurrence of spasm in the throat, changes in pulse rate, change in blood pressure or heart rhythm. No problems were associated with pacemakers. The only problematic issue was skin irritation. And the only time that I see the benefits of this not last is in a case maybe there was a stroke and maybe they had a recurrent stroke after that. But the majority of my patients remain, the benefits last over their lifetime.